Okay. Welcome, everybody, to the Town of Yarmouth's public hearing on the Community Development Block Grant Program Year 2022 One-Year Annual Action Plan. The purpose of the public hearing tonight is to hear from you. Seeing that the appointed time has arrived, I will open up the public hearing for the Community Development Block Grant Program for the Program Year 2022 One-Year Annual Action Plan. My name is Mary Wagan. I work for the Town of Yarmouth as the Affordable Housing CDBG Program Administrator. The Town of Yarmouth is currently preparing the town's Community Development Block Grant Annual Action Plan for next program year. We anticipate being awarded $125,000 from US HUD. These funds are to be used from July 1st, 2022 through June 30th, 2023. The purpose of this public hearing is to obtain comments and views of the citizens, public agencies, community organizations, and other interested parties in Yarmouth on the Community Development Block Grant Program. Community Development Block Grant programs can be used to benefit low and moderate income persons, prevent or eliminate slums and blight, or address an urgent need. Community Development Block Grant activities in Yarmouth include development of affordable housing, provision of economic opportunities, improvements to public facilities, and provision of public services. Okay. This slide shows our performance summary dating back to 2010. I know it's a little small, but basically since 2010, the Community Development Block Grant Program in Yarmouth has received $1.5 million from US HUD, averaging about $125,000 per year. And that's an annual entitlement based on the number of people that live in Yarmouth and the number of people that live in poverty in Yarmouth and our housing stock. Since 2010, we have served roughly 250 seniors annually with Meals on Wheels, 16 households with childcare vouchers. We've provided 124 homeowners with funds to pump their septic system. We have repaired 42 failed septic systems in Yarmouth. We've assisted with 11 acquisitions for affordable housing. We've rehabilitated 7 homes, affordable homes, that's in addition to the septic repairs, and rehabilitated 106 apartments. We've helped create 2 affordable accessory apartments, removed spot blight from 1 site, and provided funding for public facility improvements at 2 sites. So just to go back to this slide, here are the activities in Yarmouth that we typically fund with this Community Development Block Grant: affordable housing, economic opportunities, public facilities, and public service. And I'm going to drill down a little bit into these so you know a little bit more detail, because we'll be opening this public hearing up to public comment. So I just wanted to let you know a little bit about more of the details of each of these programs. So affordable housing, with these funds, we can do acquisition, rehabilitation, a down payment assistance, sewer hookups, and public housing improvements. And that would include new playgrounds, removal of architectural barriers and accessibility improvements, and rehabilitation of our housing authority properties. Under economic opportunities, we can remove spot blight, have programs that help retain jobs and create jobs, provide job training, assist small businesses called micro enterprise businesses. Those are businesses of 5 people or less. Provide funding for sign and facade improvements, and help businesses fix their code violations. Under public facilities, we can provide funding for sidewalks, In the past, we've helped install elevators in public buildings. We can also assist with improving bathrooms in public buildings, assist creating parks, and it says beached, but it's supposed to be beaches. In general, improve accessibility and remove architectural barriers in any public facility. Public services, which is one of the most popular programs that we have, include helping with food pantries, providing funding for Meals on Wheels, provide funding to help homeowners pump their septic systems, provide childcare vouchers, assist with homelessness services, and empower victims of domestic violence or sexual assault. So now I'm going to open this up to the public for public comment. And I just have a brief summary up here of the 4 big categories that we usually address with this program. Right now, I want to, recognize Bruce Murphy, our Director of Health.
Hi, Mary. Bruce Murphy, Director of Health. I'd like to say that the Health Department supports the many programs that you have. They've been very effective over the years. And in particular, we work with you closely on the septic repair and septic pumping programs that have been very helpful to people in need. We've also, again, asked for consideration of possibly adding home heating oil storage tank replacements, because that can be a costly repair should there be a leak. But we appreciate you going forward with the septic repairs that also include, sometimes it's just not a whole new system. It can be just a septic tank. It can be just a distribution box, or sometimes it's a line change from the house that maybe it was clogged or tree rooted. And sometimes we need to replace the line and the plumbing sewer line within the house. So it's been a great program that we've enjoyed working with you over the past number of years, and thank you very much for your time to support the program.
Okay, thank you. We received a memo from the Health Department stating that. We also received a memo from our Director of Senior Services, Diane Kane, regarding a need to improve the bathrooms at the senior center. I see that Diane is tuned in to our webinar. Diane, would you like to speak at this time? So you're muted.
Thank you, Mary, for considering your consideration in the public restrooms at the senior center. As you know, our senior center is in use 7 days a week. It gets plenty of visitors, and the visitors are from the senior centers, the regular visitors, and as well as rentals. So we have many people visiting, and they have conditions that make everyday life seem a little difficult, such as arthritis, macular degeneration, and balance issues. So we're looking to have some renovations done to the 2 facilities, so the public men's room and the public women's room. The toilets leak into the basement right now. The sinks are continuously getting backed up. Water stains are on the tile ceilings. There's cracked door stalls. The restroom facilities are very narrow, so people get stuck in there. There's no grab bars on the wall and no lever operated faucets for easy maneuverability. So that's what we have going on.
Thank you. Thank you so much. And I was at the senior center. You were kind enough to host the Yarmouth Housing Summit, and I saw firsthand the conditions of the bathroom. So I appreciate the memo and the packet that you provided, and definitely this will be of, we'll take careful consideration of that.
Thank you. Thank you, Mary.
We have another member of the community in-house. Drew Krause is here. Did you want to say something?
Well, as long as you invited me, sure. I just stopped by to learn more about this, the CDBG program, and I'm on 2 of the boards as a member, the Disability Commission and the Age Friendly Commission. And I'm just learning how people with disabilities can interact with these CDBG programs. And as an age-friendly board member, as you know, we're very interested in trying to improve access to affordable housing in Yarmouth. And we appreciate your efforts on that. Thanks.
Great. So there's no other participants that have tuned in, and we've heard from the two people in the audience. I think with that, I'm going to close the public hearing. There's material on the table. If you didn't pick up the printed material from the PowerPoint is printed out, and if you want me to visit any of your meetings, whether it's the Board of Health or the age-friendly teams, or talk about CDBG, I can. It is an annual entitlement. This year, I think, is going to be a banner year for affordable housing, and next year, probably accessibility. I do want to note that we're talking about accessibility. We have a proposed new park system on Route 28, where the old Yankee Village was, right? And there's parks on either side. So we received a memo from Karen Green, the Director of Community Development, regarding that park system. So we may be using some CDBG money for that as well. So it'll be a big banner year for accessibility. Okay. Well, with that, it's 5:15. I think we've heard from everybody. And I'm going to close the public hearing at this time. If people are interested in sending in their comments after tonight, you can do that through myself. I work at Town Hall. So my address is Town of Yarmouth, 1146 Route 28, South Yarmouth, Mass. 02664. My email is mwagan, that's MWAYGAN @yarmouth.ma.us. And the phone number is 508-398-2231, extension 1275. So those are several different ways that you can comment on the program and let us know how you think we should spend the money. And with that, I'll say goodnight. Thank you.
Well, I admit, I do live right across the street.
That's great.